Good morning everyone, Dr. Brace here for Facial Plastics Friday, and it is the last day before March break here in Ontario, here in Canada. So for all of you that are going to be traveling either today or tomorrow heading south or somewhere different, stay safe on the roads. It's also International Women's Day. I'm very blessed here at Guelph Facial Plastics and Guelph Surgical Suites to have an amazing team of women that support and surround me and our patients to give the best care possible. So happy International Women's Day to all of the sisters, wives, daughters, granddaughters, grandmothers, all of you out there, you are appreciated. Today I did want to do a quick Facial Plastics Friday on lower eyelids. This is something that we get a lot of phone calls for, and there's a lot of confusion around sort of what problems exist in the lower eyelid and what treatment is warranted. And so I'll hope to give a quick rundown on the different pathology or different issues of the lower eyelid and how I like to approach them. And so just starting from the very surface, we have the lower eyelid skin. And excess lower eyelid skin is called dermatochalasis. And this just means the skin's become thin, it's become redundant, and you have kind of wrinkly crepiness, and you'd like to have it tightened. The approaches that I like for lower eyelid skin excess are basically three, but mostly just two. So number one, if it's less than about 3 millimeters of excess skin or laxity, I like to use CO2 laser to tighten the lower eyelid skin. I've shown some pictures in the before and afters of what this does. It's really quite a great treatment for tightening the skin non-surgically. CO2 laser could be comparable or interchanged with a medium deep chemical peel, which could do the same thing in terms of tightening the skin. I prefer the laser because it's very controlled, it's much faster, we can get it done in a very expedient way, and we're not kind of waiting on the chemical peel to work, but either one will work fine. If you have more than 3 millimeters of excess skin, we're often talking about some sort of skin pinch, or if you have 3 millimeters, 4 millimeters, a skin pinch where we're actually taking a pinch of the skin and excising it and sewing up the eyelid. Now that does come with a slightly increased risk of lower eyelid malposition or tightening the lower eyelid too much and pulling it down. So you have to be careful in who you choose to do that for. If you have a negative vector eye, if your eye sticks out past the plane of your cheek, or if it's a very prominent eye, you don't want to do that in most cases because you're prone to that problem. If you have deep set eyes like mine, it's safer. And so there is a degree of kind of clinical assessment that has to happen to make sure it's a safe thing to do. If you're on the more risky side of it, you can make it safer by doing a canthopexy, where you make a little incision in the upper eyelid, you put a stitch in on the lining of the bone, you come down and you grab the tendon of the lower eyelid and you tack it up, and that can help prevent that problem. And so excess skin, we're talking about using a laser to tighten it or chemical peel, but in my practice mostly laser or skin pinch. And then very rarely, if that excess skin is associated with folds of redundant muscle or orbicularis, we do something called a skin muscle flap, which is a traditional lower eyelid surgery where you do make an incision underneath the eyelid lashes here. You lift up the skin for some distance, and then you incise the muscle and you tighten up the muscle with the skin, so the skin comes with the muscle. You do a canthopexy as well. You take off the excess skin and you sew things up. And so that's the most aggressive and the more traditional way to do it with the highest risk. So you have to have a really good reason to do it. For me, in my practice, that's usually festoons, so folds of excess muscle and skin, because there's no way you're gonna get rid of the muscle without removing it. And that's the approach for that issue. The other issue that happens with lower eyelids is eye bags or fat pads that have become prominent. As we all age, our mid-face fat pads drop. And as we have these gravitational drops, you get skeletonization of the orbital rim or the bone here. You get a tear trough or a big hollow, which people like to put filler in. And sometimes you get hollowing out here or an orbital malar groove. You can also get the big groove down here on the side of the cheek. In that case, if it's isolated to a small amount of descent, or there's no descent and there's just deep hollows, then I like to do a transconjunctival blepharoplasty. So that's a scarless blepharoplasty, where you go through the inside of the eyelid, you free up those fat pads that are starting to push against the skin, you pull them down into the cheek, and so they act as your own permanent filler, and it gives a beautiful, nice, smooth result. The issue with that is there's 3 fat pads in the lower lid. The middle and medial or nasal fat pad very easily move. The lateral one is smaller. It does not move very well. Usually if it's prominent, have to trim it, and then you end up with a hollowness here. And if you're not doing a facelift to bring that fat pad back up, then I usually fat graft that. And so lower eyelids get complicated. What happens if you have eye bags, hollowing, and excess skin? Well, then you can do a combined approach. You can deal with the fat through the inside of the eye, the transconjunctival approach. You can do the laser on the skin or a skin pinch. And you could do a skin muscle flap where you do make that incision, you lift the skin and muscle, you address the fat directly, you tighten everything up. That would be, again, the least common thing for me to do in my practice because most people don't need that aggressive of an approach. Now, what about malar bags? So malar bags are, the definition of it is kind of lateral cheek out here, puffiness, fullness, kind of swollen, watery look. That's an allergic edema thing, and it's not really amenable to surgery. So you could cut that out, it'll come back. You can do steroid injections, it may or may not work. You can do all kinds of things. It's a really difficult problem to fix. There's some evidence now, it's all preliminary with radiofrequency microneedling that can help that. I've used CO2 laser on deep mode to help that, but it tends to be more of a chronic problem that needs chronic treatments or ongoing management or maintenance treatments, and it's not fixed with one simple solution. So I hope that helps clear things up. We can deal with excess skin a number of ways. We can deal with protruding fat a number of ways. We can deal with redundant muscle folds through a skin muscle flap, and those are basically the techniques. The most common thing I do in my practice would be a transconjunctival blepharoplasty to deal with the fat, with some lateral fat grafting and a CO2 laser to tighten the skin, and that works beautifully and it's very safe. I hope that helps, and everybody have a great weekend, and again, happy International Women's Day.